Welcome back. I am here with a good neighbor of ours from Newport Beach, Dr. Michael Arata of Arata Medical, and we just saw a message from Arata Medical just before we came back. Welcome, doctor.
Thank you. Pleasure to be here.
It's a pleasure to have you here. I love seeing your beautiful offices as well.
Thank you.
You have quite a staff there.
We do, yes. We're very interested in helping people improve their lifestyle and health.
And on the message that we just saw before we came to this interview, we were hearing a little bit about the things that you do about lifestyle choices and also stem cell treatments. What can you tell me about stem cell treatments? What are they? What should we know? What's the basics?
Well, the basics are that stem cells are a type of cell that can have many effects on the body, and I think people are most familiar with the concept that a stem cell can replace tissue of some sort. That can be bone tissue, muscle, brain, etc. And it's certainly something that they can do, but it turns out that the beneficial aspects of stem cells probably are more related to their anti-inflammatory properties.
Oh, that's good to know. I mean, anti-inflammatory properties, that helps memory health?
Absolutely.
Everything.
You got it right there, everything. So inflammation really is involved with basically any disease process you can imagine. So it is really one of the central pathways within the body, and whether it's your brain, whether it's your heart, it really doesn't matter. Inflammation is involved with essentially every disease.
Yes, so you make these healthy lifestyle choices, and you were saying, especially in your message, that exercise is so important, one of the best things you can do.
Absolutely. If you kind of think about it from your household, if you have a problem in the home, one of the things you go for is WD-40, right?
Yes.
Everybody knows that. Well, stem cells are kind of like your WD-40 of your body.
Oh.
So if you have a problem with arthritis in your knee, you can lube up your knee with some WD-40 equivalent with stem cells, for example. Alternatively, if you have an inflammatory condition of your intestines, Crohn's disease,
Yes.
ulcerative colitis, things of that nature, again, stem cells are something that may help that. So it's really kind of a jack of all trades kind of treatment.
Wow.
That lots and lots of research is ongoing now. It's a very exciting aspect of health.
It is exciting, and it's new.
Yes.
It's new to so many of us.
Yes.
But I love the analogy you made, the simile you made to WD-40, and the fact that you really could just place some stem cell treatment in the knee or in the intestines. And gosh, I would probably need it in my brain. But tell me, what is that treatment like? What is that process like? Is it painful? What do you do?
Well, so there's different types of stem cells, and there's different ways to get the stem cells. Most of the treatments in the United States are what are considered autologous. So what that means is that the cells came from your own body.
Oh.
Now that has some limitations, obviously, because people that get these treatments tend to be a little older.
Yes.
And so there may be some changes that take place in our body with age.
Yes.
So you can actually get stem cells from other sources.
Yes.
So one of the things that I think people are always talking about is that you may use fetal tissue. Now that certainly is a source for stem cells, but not really in this country.
Oh.
So these are not treatments that involve a fetus at all, at least in the United States. The other option is to use umbilical material.
Yes.
So that can be the blood from the cord, it can be the tissue. Those are obviously things that are donated. So it's a completely different situation than a fetus, of course.
Yes.
And between the two options of autologous and embryonic, one involves a procedure.
Yes.
If it's autologous and it comes from you, we have to get it from you in some fashion.
Right.
That can be bone marrow, that can be adipose tissue, and those involve procedures that may have a little discomfort. Or actually there's blood derived. In other words, you just take a sample of blood, like go into the lab.
Wow.
Not to say it's completely painless, there is a needle involved,
Well, sure.
but it's pretty benign as far as that goes. The umbilical, of course, does not require any procedure. It doesn't come from you. So that's simply an infusion or an injection. And those are the different ways to get stem cells.
And so those are how the stem cells are obtained.
Yes.
But then for a treatment, say for arthritis, arthritis in the knee or in the hand, what is the procedure like to put the stem cell into your hand or a joint?
Good question. So there's really two options, and they actually be done at the same time. So one is to do what we call a systemic treatment.
Yes.
That's an injection into an IV. So just simply like getting an IV treatment at the hospital or things like that. It runs in the IV and it circulates throughout the entire body.
Wow.
If you really think about arthritis, it's inflammation also. It may not seem like it, but it is. And inflammation involves the entire body. So there's actually something to be said for a systemic treatment.
Yes.
But the effect is somewhat dependent upon the number of cells. And so if you deliver the cells locally, the concentration's higher.
Yes.
In that situation that we're talking about with arthritis, you can inject into the knee joint. And this is actually quite common. It's been done for years in terms of injections, things like steroids,
yes.
The cortisone shot.
Yes.
There are some newer agents which are joint lubricants, very common to get those injected. PRP, people may be familiar with that as another injection into the joint. And stem cells is just another option to actually use directly into the joint itself. And I find that it's probably best to use a combination of the two and
yes.
somewhat tailor it to the individual. I mean, you can clearly see some people are inflamed, and you see other people who it's not as evident. And so perhaps in a really inflamed individual, you do an IV and a direct injection.
Wow.
Whereas someone who doesn't really have any indication of inflammation, just into the joint itself may be sufficient.
Well, it sounds very straightforward.
It is.
And
yes.
it sounds like a practice that has been around for a while to inject directly locally. But when it's an organ like your heart, or like I said, I really wish I could understand what would happen for my brain and my memory capacity if I was able to be a part of this kind of process or treatment. When it's an organ like your heart, what's that process like?
Well, for things like that, of course, particularly the brain, directly injecting into the brain is not really likely to happen. Particularly with something that is not as significant as not being able to move your leg.
Yes.
With the brain itself, if you did have a significant problem, for example, if you had a stroke, there actually are techniques for administering the stem cells right into or on the brain.
Wow.
And if you had a stroke, that would be something that would offset the invasiveness and risk of the direct injection. But for most of the things that we would be talking about, memory loss, things of that nature, it would be more of an intravenous injection. And so just simply injecting to the IV, stem cells will go to the area of need. So there's actually this quality of stem cells that they're attracted to the areas that need them.
Oh, that is incredible, and that's fascinating about this type of treatment, that your body is so smart and the stem cells
yes.
can be attracted to the area that needs them.
Yes.
So very interested in the knee joint, because so many people suffer from the pain that happens. Tell me more about the process for the knee.
Well, I think one thing to keep in mind, for my practice, this is really about lifestyle medicine. And what lifestyle medicine is helping people to live a healthy lifestyle, to either regain their health or
yes.
maintain it,
yes.
or even better, optimize it. And if you think about what are the challenges, what are the hurdles people have to overcome to exercise? Well, first, the number one is probably meaning. In other words, if there's a meaning attached to the activity, you're much more likely to do it. Here we are sitting on comfortable couches and chairs. It's going to take some meaning to get us up.
That's true.
The other thing is pain. So pain is very common, and in the knees, that's
yes.
actually a very common reason why someone doesn't exercise or why they exercise less knee pain.
Mm-hmm.
So we work with the principles of lifestyle medicine, are trying to help individuals gain that understanding of meaning and connection to what they're doing. But then we also recognize that we have to address this pain. We can't just simply say, go exercise.
Right.
Now, the exercise will help their pain, as it turns out.
Yes.
But you can't get someone to do something that hurts them to that degree without some sort of assistance. And that's where stem cells come into play, because they can actually help that pain and do it in a way that doesn't require constantly taking pills that may have side effects. I mean, if you think about the common pain relievers, you're
Sure.
seeing in the news things
yes.
about non-steroidal anti-inflammatories and Tylenol, and then of course the opiates are a huge problem now.
Yes.
So taking a pain relieving pill may not be the best way to make it so that you can exercise so that your brain is happy and healthy.
Wonderful. So not only does the stem cell process help with healing and optimizing your knee joint, but it can relieve some of the pain.
Absolutely, and it's really fascinating how quickly that can occur. I mean, I typically tell patients it takes a few weeks to work and have
Sure.
relief of pain, but we're finding that usually within a couple of days it's noticeable, and they're able to start exercising, and it has this sort of accumulating effect. Once you start exercising, you get the anti-inflammatory benefits of exercise itself. So it's really fascinating to see how it builds upon itself.
It does sound fascinating. And it sounds also that Arata Medical, you help people understand the whole healthy lifestyle choice. So you help them with their exercise choices, etc.
Absolutely. And one of the key things, we're very brain-centric. The brain is really, really critical to us, as it should be to everybody.
Yes.
And there's a compound the brain secretes called BDNF.
Okay.
And BDNF is really, you should think of it as the miracle grow of the brain. It's like fertilizer for brain cells.
Great.
One of the strongest stimulus we have for BDNF is exercise. So if we want our brains to be healthy, exercise is just a wonderful way to do that. It's one of the most effective ways that we have.
And it's a 30-minute, 20-minute a day start at least, or?
Well, actually, it can be even less than that. So yes, ideally, we would like to see people roughly 30 to 40 minutes a day.
Sure.
But just getting out for 5 minutes, and it doesn't have to be, running or anything like that that's really vigorous. It can just be a nice little walk in the neighborhood. That creates positive changes within our body. And that's really the thing we want to encourage people to do. Just move.
Just move. So at Arata Medical, you help people understand the incremental steps to a better, healthier lifestyle, not only using these great processes like a stem cell process, but their exercise, perhaps eating habits.
Absolutely. It's also important. And don't forget recovery. So rest is very, very important. And in our culture, that tends to be neglected. How many times do we wake up with 4 hours sleep?
Exactly.
And then what's our day like? We're nowhere near as efficient when we get a good night's rest. So yes, exercise and nutrition is a big part of what we do, but so is sleep and recovery and connection. Our culture is one where we tend to be very self-sufficient, and it's about me. And the problem is that's not how humans have worked for centuries.
No.
And we see the problems with that in our society. So we very much encourage connection, developing those relationships, and it actually has been shown that it impacts our health. In fact, for men, one of the most important things to prevent heart disease is actually having good relationships.
Using that heart to love somebody.
Absolutely.
To
yes.
reach out and friendship. And that's a beautiful thing. It really does. It just brings the entire picture into focus.
Yes, it does.
So if we visit you in Newport Beach at Arata Medical, we can understand every step of the process.
Absolutely. And what we do is we try to identify the things that people need some extra help with. So for example, you may already be eating very well, but your sleep is really poor.
Yes.
And so that's where we're going to focus. We're going to help to bring up the areas of your lifestyle that need the most work, if you will. Try not to make it sound like it's work, but it does involve some effort, because we do have to change our behavior. That's one thing. If we're going to get healthy, we have to change our behavior. That's difficult. And so one of the tools we use are these methods of helping people to change their behavior. And one of the ways is coaching.
Yes.
So we work with coaches that help the individual to learn how to change their behavior. It's kind of like playing on sports.
Right.
It's very much similar to that.
Doctor, I love hearing this, and I'm so happy that you've come to visit with us today, because it sounds like at Arata Medical, it's the whole spectrum, it's the full picture. Health is spiritual, mental, physical health. It's not just somebody saying, hey, take this pill.
Absolutely. We tend to focus on the sort of compartments and organs of the body with medicine, and that's actually not how it works. We're all one, as you point out.
Yes. Well, it's been great to have you here today to talk with us about this, and we will be sure to catch up with you again in the future. Come and tell us how things are going.
Thank you. I
Love
look
to
forward
have
to
you
that.
back.
All
Please
right.
do.